Hello, I'm Dr. Maria Cilindro, specialized in integrative anti-aging, practicing in Pasadena, California. Uh, Good evening, and today, this evening, I have my guest speaker, and she's Dr. Cynthia. Oh, wait a second, this one is echoing. Okay, Dr. Cynthia Shelby-Lane. She is an emergency medicine specialist and practicing also integrative anti-aging medicine. Hello, Dr. Cynthia.
Hi, Dr. Maria. It's so good to see you again.
Hi.
And I know that you've been having a little issues and you're a little bit of pain. So I just wish you the best of health. And we're going to get through this, okay?
Thank you, thank you. It's I hit my neck, but we'll go this real fast, 30 minutes.
All right, we'll get it. We'll get it done.
That's right. Okay.
Yes.
So we know Dr. Cynthia. She's specializing in anti-aging medicine. So I am, and we are practicing integrative medicine. We both are not immunologists. We are not infectious disease specialists. What we do every month, the first Thursday of every month, we would like to share our experience and our knowledge in reading about COVID and vaccine to the community, so we will improve the community awareness. And you are welcome to ask questions during this live YouTube session. All right, Dr. Cynthia?
Absolutely. Yes. Any question you have. And if we can't answer it, we'll find the answer for you later.
That's right. Okay. So today we are going to do the update of vaccine. And it's just happened. We would like to just chat within these several issues that come up for the last month. And one of them is long hauler syndrome of COVID-19. And this one came as the name of long COVID-19. And what that one is about the lingering effect of the symptoms that people have when they got infected with COVID-19. And after they become PCR or COVID negative testing, they still have the symptoms. And those are usually fatigueness and weakness. And some of them still have a numbness and tingling or difficulties with the smell and difficulty with the taste. And some of them, they cannot even sleep at night, and they have difficulties going back to their previous job. And do you heard about this, right, Dr. Cynthia?
Absolutely. Absolutely. So, maybe I could just give an update on where we are in the world today with the data, the statistics, so people will know that. And then we'll talk about long haulers, which is really COVID-19 syndrome. Then people who have reinfection and people who have long haulers. They had the infection, but they still have the viral load in their body. So just an update, because, it's been like 1 year since this all started, a year ago, like March of 2020. We're into this a year, so we've learned so much about the pandemic. There's so much we didn't know. There's so much we know now, and it's a year later. But there's a lot of misinformation and misunderstandings. So you and I think we've dedicated ourselves once a month to just try to keep up with it and let the community know what's going on. So globally, because I looked up the data, because I have to look it up on this day for this date, 115 million global cases, over 115 million. US cases, 28 million, over 28 million. Global deaths have been 2,500,000 plus. The US at over 519,000. And then I'll go the top: US, Brazil, Mexico, India, and UK, and then Italy. So the cases are still rising, and we're still trying to fight this pandemic the best we can. In terms of those who have been vaccinated, for the numbers, in the United States, 15.9% of the population has been vaccinated, and it's close to 80 million people. And that's the first dose. About 8.1% have gotten their second dose. So out of those that were distributed, there were 107 million doses distributed, but only 75% has been used. So somewhere there's a gap. You can see that there's a gap. We'll talk about distribution a little later. But hospitalizations are going down. But I know you and I talked about what's trending. States are about to lift restrictions as of April 1st. Most doctors and even you and I, this is probably too soon. The president of the United States, President Biden, said that probably most people in the U.S. will be vaccinated by the end of May. But 17 states have said, nope, restaurants can open and you can go to the theater, you can do whatever you want. People, please don't do that. Don't do that. Just don't do that. Don't, please.
They don't, but they still want to go out and travel and do everything.
Yes. So they're thinking a fifth wave is coming, another wave. So just be careful. Whoever you listen to, make sure your data is correct. But you have to protect, and we'll talk about that at the very end about what's going on and some of the myths. I'll go over that too. So. All right, so you and I are going to discuss long hauler syndrome. So let's go into that just a little bit so people will understand what that means, from people who are initially infected to people who have reinfection, and then people who have long haulers. Long haulers is a little different than everybody else. And I think they did a study, like 3,700 people have self-described themselves as having COVID-19 long hauler syndrome. And you talked about that, but how would a doctor or a patient or us know that that patient is suffering from that problem? What would be the first indication?
The first indication is, some of my patients, I think I only have one patient long hauler so far.
Mm-hmm.
He was positive, he was treated, and then after two weeks later, with all the medication and the treatment and the supplements, suddenly he developed pulmonary embolism and also thrombocytopenia. So he was admitted and they tested his PCR went positive again.
Okay.
Very weird, but he did get his first vaccine. And so not so sure on the definition, but out of the 62 people of the patient that was in the study, is that the University of London in England?
I think it is, yeah. I have the data here, so I think that's the study, but it's pretty, yeah.
So they develop what they call anxiety, they cannot sleep, and they become fatigued and weak.
Yes.
And that's the symptoms they describe in that report. And then they extend it for a period of time, even up to 6 months. And that was the report I read.
Yeah. Yes. And that was at the University of London, I think.
Yes. But in my population, I always advise my patients to prepare for their vaccination. They have to be healthy, and so we prep them with all the supplements they need to support their health to be optimal. And then after the vaccination, they have to continue. In fact, some of them who are not so healthy, I said just double your vitamin C, double your zinc, double your vitamin D and quercetin, because basically if you get vaccinated, they introduce COVID-19 like thing.
Right.
So you develop that reaction. And most of my patients bounce back really fast because they only experience the vaccine symptoms, which, just like a flu-like symptoms.
Right.
Most of the one that took the second vaccine develop a little severe symptoms. Some have the rash, and some has the vertigo, and some has the severe headache. But usually is after like 3 to 4 days after their second injection. That's what I think about that. And then so when you heard about about the long COVID-19, what do you think you should do, right?
Right.
That's what I usually say. Just continue taking your supplements. Don't worry, as long as you don't have chest pain or hard to breathe, then you're fine, and just continue doing your supplements. and
Right.
so but you mentioned a very interesting things about we are going to be a little bit more severe in this COVID-19 season, which
Yes.
think it's we are talking about these variants of COVID-19, UK, South Africa, Brazil, and but
Yes.
I'm in California, you're in heaven. So, it's a little bit different, right?
Yes. I know because California has,
What you heard from your side, because in California, we found everything.
in terms of the variants,
Yes.
every single one, right?
Every single one is in California. And
Every single.
the B117 will be worse in California at the end of this month, which is March.
Yes, yes. So it's like this another wave is coming.
Yes. Uh-huh.
Yeah.
You want to share a little bit about these variants, or we'll just pass it?
But you know so the virus mutates, and it's been mutating since last year. So these are the ones that are causing a little bit more of a concern because they're getting into the body, they're mutating, people aren't protecting themselves, and so we're thinking they're more easily transmissible. And that's what I go back to say. You still have to protect yourself. You still have to social distance. You have to wear a mask because these variants can evade your own innate immune system. I think we talked about that last month, and they can evade the vaccine. So that means that if you had COVID before and you built up some immunity, and if you have the vaccine, and if the variant comes along, you can still get COVID again. And that's called reinfection.
Yes. Yes. In fact, I think the concern about the variants, Dr. Cynthia, is because if you are vaccinated with, for example, it to me it makes sense because the vaccine that you receive is less is for a variant that is less severe than the, let's say, B117 that they call
Right.
monster coming and whatever they name this variant. And so then you have to be I don't see nobody knows exactly when you'll get the booster or when your antibody will go away. And
Right.
many people that receive vaccine, they are not even tested for their antibody.
Yeah. Yeah. They're not. Right.
Yeah.
Uh,
And yesterday, I heard from this melatonin webinar that if you are under a lot of blue light, which is like a computer, yourself,
mhm.
this like kind
This. Right.
of with the YouTube, you know, your melatonin in the production of at night, let's say if you use the blue light within an hour before you go to bed, that will retard the production of your melatonin, and that will make your body inflame, and that will prevent your antibody to develop. So that doesn't mean that you get vaccinated then you are immune forever. No, that
Right.
true. And in fact, that is why the efficacy is not even 100%.
Right. Absolutely. So sleep is important, and taking care of your body prior to getting the vaccine is important. And just what you mentioned about melatonin is important. Would you? So I can't take melatonin because I have violent dreams. I'm getting ready to do a sleep and dream seminar. It's out in Marin, California, a TEDx talk. I'll send you the link, and yeah, I'll invite you. And it's about sleep and dreams. And I asked them all these questions, which will come up on April 16th of 2021. And I want to know why some people are so sensitive to melatonin with the violent dreams and REM sleep. So I know melatonin is very useful for all of this and for sleep, but I can't take it. So I'm just gonna bypass melatonin for the time being.
Yesterday, Dr. Ross said that if there is an immediate release and there is a, time release or slow release, right? So
Uh,
if you're very sensitive, you ought to take slow release so you don't
slow
get
release.
in the initial ingestion of the melatonin.
Yeah.
And of course, she wouldn't know the quality because
Mhm.
everyone gets melatonin from a different source.
This-
But yeah, maybe it's good to try again. But if you're afraid that you dream so much, are very scary in the afternoon. She did
yeah,
mention it for immune system. You take it in the afternoon, not in the
night
evening.
at night, right. Well, I'll try it. So you know what my dreams are about. Do you want to know?
Okay.
Denzel. Okay. But he won't talk to me. He doesn't like me. All right, so let's keep moving. I don't want to stall here. So the other thing we talked about. Any questions? Anything you want to ask me?
Uh, well, okay. I think now I can ask you about. Let me see. We
Hold on.
talk about the vaccine now. We talk about the COVID already, right? So,
Mhm.
what about this vaccine? What is the study of this? I think the different kind of vaccine, right? What what about distribution of vaccine? You know better about distribution. See, in here we just go to our website, local website, and then you know where to go and make an appointment, like
Mhm.
or I think stadium
Yeah.
there is, and then Walmart or CVS. And since I haven't got my vaccine, and so how about distribution in your area there in Michigan, Chicago,
So
or
so if you look nationwide, it's called planyourvaccine.com. Planyourvaccine.com. That's where people can go to find out what's happening in their locality. I'm in Detroit, so we're getting upgraded in terms of the distribution is improving. And anybody, even from in Michigan, from outside, I guess you can come from California and get it. But if you come to Detroit, you can make an appointment and you can get your vaccine almost immediately. So people are getting their second doses here. It's been a struggle because, like I said, there's like 107 million that were distributed. Only 75% of those have gone into arms. And that's because state and local governments have been not coordinated very well. So that's been the problem with distribution. On the other hand, people are trying to figure out, should I get Pfizer? Should I get Moderna? Johnson and Johnson just came out with a single dose. People are still leery. They have some vaccine hesitancy. People, if you have 107 million and only 75% have been distributed, there's some consciousness problems for people that don't trust it. So that's why I think talk to your doctor, see what's going on in your local government, go to planyourvaccine.com and figure out how to get it scheduled. You know, there's been some problems with distribution. There's been people stealing vaccines as well. So
this is very sad. So
there,
it's still the same that in your area that the hospital use the Pfizer and the Moderna is distributed outside the hospital.
no, we're in parking lots and casinos now getting Pfizer as well. So it's isn't that's kind of wild. I think this whole thing, where'd you get your test? In a parking lot. Where'd you get your vaccine? In a parking lot. So that's the new healthcare parking lot medicine. But it's working. It's working as long as we can communicate to patients and they know where to go. I think the biggest problem has been in the most at-risk population, which is 65 and older, people with illnesses, people who are poorer, people who don't have access to the internet or cell phones and don't know how to use them. So they're trying to do, if you bring somebody to get a vaccine who's 65 and older, you'll get your vaccine too. So they're doing that kind of buddy system, and that works. It works. There's got to be something more than just everybody knows how to use the internet, because that's not the society we live in. Everybody doesn't know how to use the internet. You and I do. Um, it's like older but savvy. So you just have to know what to do and how to get your vaccine. So planyourvaccine.com.
Planyourvaccine.com. Okay. Now, with the vaccine, the type of vaccine available in my area, it's still just the two, which is the Pfizer and also Moderna. And
Mm-hmm.
Johnson and Johnson, although is already EUA, emergency
Right.
use site authorization approved, but I don't think they distribute it yet until maybe end of the month. I'm not quite sure when they are going to start.
Yeah, yeah.
Heard before the Johnson and Johnson or Janssen, the
Yeah,
company
Jensen.
before that, AstraZeneca was EUA, and with the AZD 1222, right? That's a
Mhm, mhm.
1222. I know because my son is working with AstraZeneca, so I
Uh-huh,
said,
uh-huh.
send me all this article in Lancet. So boom, I got
Yeah.
the article. But I haven't heard that anyone get anything from AstraZeneca. Have you?
So I know people who were in the studies, and that was in somewhere around December.
Yes.
And I don't know that this being distributed as much as Pfizer or Moderna. Johnson and Johnson just was able to be shipped out and distributed this 2 days ago or 4 days ago. So
Oh,
it's new. And then there's the other one is a Merck the manufacturer is helping Johnson and Johnson. So that's how Johnson and Johnson will be boosted. So Johnson and Johnson is planning to put out a lot of vaccines for the in a single dose. Now the efficacy they say is only 75%, and then people hear, well, if it's only 75%, shouldn't I get the one that's 90%? People, the experts are saying, get whatever you can get.
that's right. Get whatever you can get first.
Yeah.
Okay. Value. Because this efficacy depends on where they test it. And
Yes.
apparently, that's also I believe it's also depend on the environment and
Mm-hmm.
on the innate immunity during the patient has during the vaccination. And
Right.
I think the best is get what you can get. Yes. And what else in the vaccine here that we have to discuss? If not, we can move to perhaps talking about children and
Children. All
adulthood.
right.
Yeah. So this kind of vaccine for children or pediatrics, there are not much information yet. However, the monoclonal antibody products, it's EUA for um, COVID-19 non-hospital adult and also pediatrics. Now, pediatrics is definitely less than 18 years old. However, they are not going to distribute it. You have to it's like almost a prescribed for, and it's by the ABC, which is Amerizone Virgin Corporation. So this is made available and it's approved, but you have to order. This is
Mhm.
what I heard. And I'm not quite sure if they started already, but I'm pretty sure some of the patients who are suspected prone to be high risk of COVID-19 will get it first.
You're talking about children. Children.
Children, pediatric.
So what I know about the children, they're doing studies. Pfizer completed a study with adolescents 12 to 15, and they began last year in October. And Moderna is enrolling 3,000 children 12 to 17. But they're just doing the studies now, and they think that the information should be available by the middle of the summer, because the issue with children is that children are at less risk. On the other hand, um, don't the teachers want to keep the kids in school? The kids want to go to play ball and sports. Everybody wants to go out with their families. And so children could not get as sick, but they could easily be carriers. So it's going to be interesting to see how it works for children and what's going to happen and who gets immunized first in the pediatric age range. But the studies are being done now, but there's only a few people, like 5,000. That's a low number at this point in terms of children are 1/4 of the population of the United States. 1/4. So if the population of the United States is 331 million, you're talking about like, well, you did math. That's 1/4.
Yes, yes. Mm-hmm. 70 million.
Yeah. And the other issue, we talked about this before, was the syndrome with children, multi-system inflammatory syndrome. It's called MIS-C because there's MIS-A for adults. And children, some of these children are starting, who got COVID, are developing sort of long haul syndrome as well.
Mhm.
The parents are saying, my daughter was a great student and now I can barely get out of the bed. She's not doing well. So there's got to be some concern about children's health and prevention as well. Children with vitamin C, children vitamin D, children, just taking care of children's health the same way we're taking care of the adults
Correct. Yes.
in
Uh,
prevention.
yes. So, Dr. Cynthia, let me read you a few of these questions so that we know whether we had answered it or not. Maybe that's
Okay.
the best. Okay, because Colleen, what exactly is meant by long haulers now? So, you want to answer or I answer? Let me
You can,
explain a little
okay,
bit.
go ahead.
Long haulers is those patients who had COVID-19 infection and be and treated, and then the doctor or the health practitioner think that they already had gone through the infection, but they still are experiencing the symptoms. Just like Dr. Cynthia said, the student could not get their previous grade, which now has declined in their performance at school. But
Mhm.
some adult who has long hauler syndrome, or the short form of that is long COVID-19, they cannot go back to their previous function. In rehab, we call it that way, which is very true because they still feel fatigue, they feel weak, they cannot sleep, they have not been able to eat well. No, they lost appetite because they
Mhm.
cannot smell normally, they cannot taste normally. I have a patient who had, now at that time we did not have even the test for COVID. That was December 2019. They
Right.
had severe flu, and we did not even wear masks. I can still
Right.
remember.
Right.
I have to listen to their lung and everything, and they cough next to me. But you know what, Dr. Cynthia, they swear they probably had COVID.
Absolutely. I hear people say that all the time. I had COVID last year. And you don't want to blow them off because there was no testing. Nobody knew.
They did not
And
test. Yes.
didn't know. And they were admitted they had pneumonia in January. They had something in January. They had something in December. And all of a sudden they got tested in March. And that's when they finally figured out what was going on. So yes, the people did have it. But the long haul people have symptoms 6 months after being tested positive for COVID, and they are still fatigued and tired and they can't get their energy back. And one woman I read about, just read, it's anecdotal, she was a fitness trainer and she has myocarditis, heart problems. So
Yes.
it's affecting the whole system. It feels like it's, to me, it's affecting the mitochondria, the cellular engine. And so you're just fatigued and tired because you can't get the engine going anymore in the body, which is in our cells.
Yes. And in our um in our field, integrative medicine, we know when we say rejuvenate and reversed and rejuvenate. So, like replenish and rejuvenate, right? So
Right, right.
to replenish the mitochondria, right? So
Yeah,
now in the medical conventional medical, we were not taught how to rejuvenate mitochondria.
right. Or the cell, right. The cell health. Yes.
Yes, so many patients, believe it or not, they have the symptoms. They tested positive. They are sent home to rest for 14 days and
Yes.
call your physician. So
Right.
their physician at that time, the situation was very confusing of how to treat this patient. Now we know a little bit better.
Mhm.
From the 3 million people that got ivermectin, they got doxycycline, they have budesonide, so we just do it and then they got better.
That got better. Right.
Long haulers, if the symptoms linger all the way until 6 months or more, or even a year, because now it's a year, some
Yeah.
patients swear that they had COVID and now they lost their taste.
Right. And those people still have that problem. I'm thinking, I know Dr. Fauci said they're at the NIH. They're getting ready to do a huge study on long haul syndrome or long COVID. It's called long haulers, long COVID, and if they do the test properly, they're probably going to find some mitochondrial dysfunction. That's just my thinking. And it's because it sounds like somebody who has congestive heart failure almost. It's like I can't get enough energy. I can't get enough breath. I don't know what's going on. My brain's in a fog. I can't think. I have memory problems. All of those things are related to long haul after you tested positive for COVID, whether you were hospitalized or not. So those are kind of the symptoms that people are having.
Yes, yes. Now the second question, let's finish the question, then
Okay.
we will go to close this one.
Okay.
I have to take third vaccine.
Will they have to take a third vaccine? Is that the question?
The question is, does one have to take the third vaccine? I haven't heard that you're supposed to take the third vaccine, but I know that we do not know how long this will last. The first and second vaccine, it will give us immunity until maybe 8 or 9 months. But to me, it is best to test the antibody.
So nobody knows that. The answer to that is I don't know. None of the experts know. There's not enough research being done. The CDC doesn't know. Johns Hopkins doesn't know. They're waiting to see. It's just like a year ago, we had COVID. We had no testing, we had no anything. And now here's a year. And now we've learned so much. They're not going to know for probably another year. They're suggesting that you may need to get a booster similar to like the flu, and the flu. You know how the flu varies every year? That's why they make a new vaccine. That's why I got to get a flu shot this year. Didn't I get it last year? Well, there's some variants. And so nobody knows. And there's that is the unknown part of this whole syndrome.
Yes, I'm going to share with you a little bit what I read about this. After the first and second vaccine, some people even have gotten a COVID infection now.
Yes.
How do we benefit from that, right? Well, when you have the vaccine, you are expected to develop antibody. Now, common sense, you think that with the antibody and you have this COVID infection, then your body is ready to fight. So it reduced significantly the mortality. And this
Mm-hmm.
proves that after so many people got vaccinated, the hospital now is not jam packed like a month ago, right?
Mm-hmm. Right.
So, however, they mentioned that many people that did not have a good immune system or optimal health, and they received vaccination, they still could not develop antibody
Mm-hmm.
because their body were inflamed, and they were inflamed when they received vaccination, so the antibody has difficulties to develop. Now this has to you have to understand. So when you have vaccination, and it doesn't mean that you can just go freely without health protocols and things like that, right, Doctor?
Right. Absolutely.
So what do you can you share with us all these? If you get COVID infection, what do you need to do, right? So
Okay, so if you get COVID infection, remember these basic things. So you've already mentioned nutritionals that people need to take. Vitamin D, you need to be on vitamin D consistently. You can't wait until you get sick. Vitamin D doesn't work like that. You need to remember to wash your hands. Remember, it was happy birthday to you. 20 and then wash your hands. Even with sanitizer, if you don't use the right kind of sanitizer, it's 25 seconds. And sometimes the sanitizer, the amount of alcohol is reduced if you keep it open. So sanitizer doesn't substitute for washing your hands. And if you catch it again, you're going to have to quarantine. You might need, as Dr. Maria said, ivermectin, vitamin D, quercetin, vitamin C. Wear your mask. I'm just saying, wear your mask, be careful. And it's kind of simple, but it's consistency. That's what it is. It's consistency of healthcare. Exercise, get the right amount of sleep. Those are real basic things. Lay off the ice cream.
yes, sleep. The sleep is important, especially
Sleep.
plan to go to get your vaccine. You have to sleep 8 hours. For a few days, you sleep 8 hours, then you are. I think this is because you need that melatonin to reduce
Yes.
inflammation.
Right.
First, until I think 2 days ago, I had this webinar and said, "Oh my gosh, now I got my answer. I want to share." So another question. Let me just read all these questions real quick here.
Okay.
How one is tested for COVID antibodies? Is it different than being tested for COVID? It is different.
Yeah.
Tested antibody through your blood. Your PCR is through your nose or through your throat. Okay, so that's called swab, and this
Right.
antibody blood testing. Now and then, Mikael, such a great info, Dr. Cynthia. I cannot take melatonin either. I always get violent nightmares.
Yes, my friend.
Yes, many of my patients do say that. Then I will have to adjust. But luckily, maybe I always outsource good supplements from good manufacturing company. Many of my friends never complain, and I have had these 3 milligram TR. Maybe I should ship it to you, Dr.
Yeah, please do.
And for Pastor Carlos, husband and wife. This is a very good question, and everyone should know. Husband and wife have been diagnosed with COVID. Do they have to quarantine, live, or sleep separately? My answer is yes. What do you think?
Absolutely. There, I just read an article about COVID in the household and what you have to do. And you do have to, you're supposed to be separated. You're supposed to do, but wear your mask in the house all the time. It's very difficult when and that's what happened even in middle of 2020. One person had it. There's different bathrooms. Can the water splash up? If you go to the bathroom, where's the COVID going? Yeah, you're supposed to do that. That's the recommendation. So as much as you can, wash your hands, sanitizer, masks. Don't sleep it together.
Okay. Now, has there been any research on pregnant and breastfeeding people and the vaccine? Should I wait to get the vaccine until I'm done nursing with my baby? I read about that, and they do not recommend vaccine when you're breastfeeding. How about you, Dr. Cynthia?
I recommend you talk to your gynecologist who may not know as much as we do, but that's still who you have to talk to.
Yes.
And at this point, there's not clear recommendations. So you're always going to be sent back gynecologist, or pediatrician as well. But at this point, I would probably veer on no. It's just an opinion. I don't know. You just have to get more information.
Yeah, yeah. I got it last week from one of the webinar and said if you are breastfeeding, it's best to wait. And well, I'm not quite sure whether that's true. And that's a good suggestion. Ask your gynecologist.
Right, right. Because they're going to be the one that's responsible for your long-term care and ongoing care as well.
Yeah. Is it true that everybody can avoid to be infected with COVID-19? Cannot avoid to be infected with COVID-19? Is it true that everybody cannot avoid to be infected with COVID-19? Well, don't forget, COVID-19 is a viral infection that is majority of people who get it are asymptomatic. But when you say virus infection, it doesn't matter whether it's COVID. You are subject for any infection.
Yeah.
So that's a property of virus. But unfortunately or fortunately, majority are asymptomatic in this matter, in this COVID-19 matter. Right, Dr. Cynthia?
Absolutely. And I believe that you should be protecting your immune system for the rest of your life, because when we become elderly and we look at comorbidities and people who are in the hospital and they went in for a heart attack, but they died of an infection. They went in for something and they died of an infection. So protect your immune system. I think COVID is just taught all of us a lot, that we're very fragile. We're very fragile on the planet. We're not wearing plastic shields. We're not plugged into a socket. We need energy, and we need to protect ourselves. And that this one little virus, I don't know if you ever heard that saying, "Don't sweat the small stuff." Sweat the small stuff. Go to a hot sauna. Sweat this out. Protect your immune system. All of those things are good. I think we're talking about just sort of common things, but people don't. There's science behind all of this. There's real science here.
Yes, yes. For closing, time flies so fast when you are having.
I mean, they're fun. Yeah.
For closing, anything here for the best closing message for our audience today for COVID and vaccine before we come again next month, the first Thursday.
This has been interesting to me because it's called Life After Lockdown. And we're getting ready, 17 states, people are getting ready to go out. Some people don't really care. 17 states don't care. But 46% of people said, I'm not comfortable. I'm not comfortable going back to life. I'm glad I live with my family the way I did for the past year. They have reentry anxiety, and anxiety is going up. So I just finished a course at Harvard. It's called, I learned the relaxation response. It's called stop, breathe, reflect, and then choose. If you could just do that, it's not even mindfulness or meditation. Meditation's about, but stop, breathe, reflect, and choose. Now remember, we're just all here in this together, and remember to love one another. That's all I can say. More love.
Thank you. And
Okay.
so everyone, just to remind you, protocol is still in place, although you have vaccine, and also continue to take your supplements to support your health. And I would like to say goodbye to all of you and thank you, Dr. Cynthia Shelby, integrative medicine, practicing in Detroit, Michigan. And I'm Dr. Maria Sulindro, integrative anti-aging medicine, Pasadena, California. Give like, subscribe, and share to everyone. Okay?
All
Thank
right. Thank you, Dr. Maria. Thank you so much. Thank you, everybody.